Thank you very much, Freddie. And thanks for joining us. I know it's a Friday evening, and I know you've been working really hard in the ICUs. Just to kick things off, I know you wanted to start us off a little bit, just discussing a couple of questions that community members have submitted to us. So, do you mind kicking us off and talking about a couple of hot topics related to COVID-19? I think one of the biggest topics was currently with ICU and hospitalizations in relations to COVID-19. And I guess a more direct question is, how is the ICU currently with COVID cases, and what are the rates looking like for unvaccinated folks, for hospitalized versus vaccinated?
Right. So as far as what we're seeing right now in the COVID ICU and hospitalizations, as of right now, at the beginning of the year, we're seeing about, I want to say 50 to 60% of our COVID ICU is filled with actual COVID patients. And these patients range from anywhere between 30 years old all the way up to like 66 years old. But I would like to caution that every week, or at least every day, we're seeing more and more people coming into the ICU. And on top of that, we're seeing all of these patients in the ICU as people who are at least 90% of them as unvaccinated individuals. And the 10% to 20% of individuals as being vaccinated, but unfortunately did not get their booster and are also immunocompromised. So the majority of our patients in the ICU are still unvaccinated. And unfortunately, a lot of times they are the people who might not believe COVID is still real or the vaccines work, or that their only treatment that they want is ivermectin and other treatments that have been proven not to work. So working with those patients and trying to get them to take their medications in the hospital has been super difficult. Some other things I wanted to mention as far as hospitalizations and things with our health system is, now with the rise of Omicron and with the holidays sort of like behind us, at least a week behind us, we're starting to see a lot more people who have been exposed during the holidays start to make our emergency departments more overwhelmed. So some examples I've seen over this week are in our emergency departments. A lot of families who weren't able to get rapid testing are now coming to the emergency department seeking testing, even though they aren't feeling any of these severe symptoms. So that is something that we are all currently seeing. And unfortunately, when that happens, is that our emergency departments are now filling up, and we can't take care of some of the more sick patients, such as those with strokes, car accidents, and other emergencies that require more medical attention. And instead, we have to attend to people who might have mild symptoms, but we're panicking because there's no more tests and end up taking up beds at an emergency department when it's not needed. Some other things we're also seeing with the rise of Omicron is shortages in healthcare workers. So a lot of healthcare workers getting sick over the holidays, unfortunately, because of how contagious Omicron is. And we're also seeing shortages in medications related not only to COVID, such as remdesivir, monoclonal antibodies, and things like that, but also medications that can help our other hospital patients, such as things as simple as sodium chloride, IV vitamins, antibiotics, and other common medications we see in the hospital. So there's a shortage of all of these things that are starting to creep up, and hopefully over the next couple of weeks, we don't see a surge. However, given the holidays, it's possible we'll see more hospitalizations, and hopefully by then we can get more of our healthcare workers back to work, and that will help what we're seeing currently in the healthcare system.
And so in relation to Omicron, are we seeing more hospitalizations due to Omicron and during this surge because of sort of folks feeling symptoms? Okay.
Right. Yeah. So as far as specifically hospitalizations, surprisingly, or maybe we're a little bit too early and there's not enough data yet, we haven't seen the hospitalizations follow the spike in cases we're seeing, because we're seeing, at least in the United States, anywhere between 500,000 to 1 million cases per day. But usually hospitalizations will follow 14 days after cases start. So we'll see what happens in the next couple of weeks. I think that's going to be really telling of how scary Omicron really is. Some things that people have been saying on the news is that Omicron has a lot more milder symptoms, which based on the data that we have, yeah, I guess that's sort of kind of true, and we're obviously going to touch on this later. But that doesn't mean that it's a milder experience for our healthcare workers.